Most people think that heartburn is caused by too much stomach acid. But what if I told you that for many of the people that we work with doing functional medicine, that it's actually the opposite? So I'm Dr. Adam, and in this video, I'm going to show you why low stomach acid is often the real problem and what you can do to fix it naturally. But we've been told for decades that heartburn is caused by too much stomach acid. And that's why most people end up using Tums. It neutralizes the acid. But is that really what's happening here? Well, looking here, this is your stomach. Okay, this is the esophagus that leads up toward the mouth. And inside your stomach, there is stomach acid. So these wavy lines are representing plentiful stomach acid. And that stomach acid is good. It's supposed to be there. That's how your stomach digests the food that you feed it. Now, what happens in heartburn is that, yes, is there acid refluxing up here into the esophagus? Yes, but it's not for the reason that most people think. Now, most people think that it's because there's too much acid, and that's why they'll use acid blockers, PPI medication to blunt the amount of stomach acid that's refluxing upward, or they'll use antacids, which like Tums just basically act to neutralize the acid here. But the problem with this is that these things often just make things worse in the long run. So instead, let's talk about what's actually happening. So what's actually happening in most cases is that there is low acid. I'm going to draw this out to show you what this looks like. And that is because there is a weak valve in your stomach. I'm going to show you what that looks like here in a moment. And that is what leads to reflux. When there's too little acid, it looks more like this. Just a little bit of acid there. Okay, so your stomach acid isn't just for breaking down food, it's also to help things move in the right direction. So there's normally a valve here called the lower esophageal sphincter. It's just a valve that opens and closes. And so here's the open position. And so how does it know to move between these two positions? Well, it's based on a chemical sensor that's on this valve, sensing the amount of acid that's in your stomach. When there is low acid, this valve is open. When there's higher levels of acid, this valve closes, and that's what prevents the acid from refluxing upward. So yes, when there's not enough stomach acid, this valve will be in which position? Open. So it's open, that allows the little bit of acid that is in there to reflux upward. And that's what causes that burning in your chest. So instead of shutting down your body's ability to make stomach acid, let's support it naturally. And so here are three natural ways that you can do that, right? This is fire, right, for heartburn. Get it so that we can slash heartburn for good. Okay, the first way we're going to do that is by managing stress. The stress is a huge detractor from your body's digestion, your digestive ability, because when you're in a stress state, your body cannot produce enough stomach acid. So the first thing is to learn how to manage the stress in your life. Stress will always be a part of life. It's never going to go away completely, but you can control how you respond to it. And so starting a short guided meditation practice, a breathing practice, some type of belly breathing, 5 minutes a day. You can find plenty of guided meditations on the internet and just make a habit out of that. Teach yourself how to become more resilient to that feeling of stress when it comes up. The next one is going to be to slow down. Slow down and stop rushing when you're eating your meals. So you really want to help your body, just like the stress, right, is to help your body achieve the opposite state of feeling nice and relaxed and calm and ready to go and ready to eat when it's mealtime. So this also means that when you're eating, you don't want to be driving, you don't want to be watching TV, just focus. Just use your mind to intentionally focus on the meal at hand and how beneficial that these nutrients are going to be for your health, because I'm, assuming that you're also choosing nutrient-dense foods. So, slow down and you want to chew. You want to chew until your food becomes mush, complete mush. That makes it easier on your digestion and your stomach to handle the digestion and breakdown of that food instead of handing it a full, a full piece of, whatever it is, a potato that's totally unchewed. You're not a snake, okay, swallowing its prey whole. You want to slowly use your teeth, chew it 30 times. Yes, I said 30 times per bite. That will ensure that you're slowing down, you're being intentional, and not eating mindlessly. Okay, it'll also help prevent gas and bloating downstream because your body will be able to digest it more effectively when it's been chewed well. So slow down and chew. The last one is to support acid. So you can do this in a few ways. One is you can eat bitter foods. So a bitter food, first that comes to mind is arugula. It's a bitter green, a leafy green that you can eat at the beginning of your meal, kind of as a salad, or you can use it in the meal as well. There's also lemon. Okay, using lemon, of course, squeezing it over the meal. You also have lemon in water, 10 to 15 minutes prior. Squeeze a half lemon in 4 to 8 ounces of water. That'll help get your stomach fortified with acid. And lemon is acidic. Okay, the other thing you can do is take supplemental HCl. HCl is hydrochloric acid. That's it's betaine HCl is what it's called. You want to get a high quality betaine HCl and dose that appropriately. So those are the 3 ways that you can support your stomach acid naturally. So how do you know if you're really deficient in stomach acid? Well, in the absence of more advanced testing that's pretty hard to get access to, there is an at-home test, a DIY test, do it yourself. And this test is not perfect, but it's pretty good. Okay, so this is called the baking soda test. What we're going to do is first thing in the morning, before you eat anything, is before eating or drinking anything. You're going to take an empty cup and you're going to put baking soda and water into this cup. And take about a quarter teaspoon of baking soda into, say, 4 to 6 ounces of water. Okay, you're going to drink that down. Then you're going to time it. You're going to set the clock for 3 minutes. Okay, so 3 minutes. And what you're looking for is to, within that 3-minute time frame, you're actually looking to see if your stomach produces a burp. Okay, a nice healthy burp. And so what does that mean? Well, why is that happening? You have stomach acid in your stomach, as we discussed. Baking soda is a base. So you have an acid and a base. If you remember from Chemistry 101, those two are opposites. When you bring them together, they react. That chemical reaction creates gas. That gas manifests in the form of a burp. So if you have a nice big burp, might be 1 or 2 or 3, within 3 minutes, that's a good sign, adequate stomach acid. No deficiency. But if it takes longer than 3 minutes, okay, you want less than 3 minutes, but if it's longer than 3 minutes, anywhere between 3 and 5, you might have a mild stomach acid deficiency. Or if you just have very small kind of wimpy burps, okay, that's also a sign of mild deficiency. If it's more than 5 minutes, up to 10 minutes, or you just never burp at all, that's a sign of more severe stomach acid deficiency. So if that's the case, again, rewind, go back to those 3 tips that we just talked about and implement 1, if not all 3 of those tips. And that will start to help support your body's ability to produce more stomach acid and digest food more effectively and stop having heartburn. I hope this helps you start thinking differently about your heartburn. If you or someone you know has been relying on antacids or PPIs and still not feeling better, you're not alone. Send this video to them and help them understand what's really going on at the root and how to overcome it. It might be low stomach acid, not too much, and now you know that there is a natural way out of this. So if you want to dig deeper and you want to heal your digestion at the root, click the link in the description to check out our approach and potentially get some help here. But at the very least, like the video, subscribe. We'll see you in the next one.